Happy International Midwives and Nurses Week to say that the theme of these International Nurses and Midwives Weeks is, of course, that the nurses make a difference anytime, anywhere, always. In everything that we do, let us always leave a mark, and a positive mark. Do the little that you can. If each and every person changes wherever they are, then we'll be able to change the facilities we work in. So thank you very much and feel welcome in Thika Level 5.
But I think our job here today is recognizing that this institution in Thika and in our county and countrywide would not be the same without the care you give, the dedication, the passion, and the commitment. We have registered a Thika Level 5 foundation, which has its separate account. We are looking for donations in equipment and also want to build a trauma center within this institution. If anybody feels he wants to donate any money to the Thika Level 5 hospital, we are accountable. The board and the hospital superintendent are signatories. We can put money into that account and we can be accountable so that it's not mixed with the running of the institution. So mine is to thank all the donors who've done it in the past and also look for more support in the future.
I want to send this message to all the healthcare workers that the current administration under His Excellency the Governor Dr. Kimani Matangi is different from what you are used to. What happened like 2-3 weeks ago when he, under his guidance, we were able to issue promotion letters to healthcare workers. That is just an example to tell you that it is not going to be the same again. We are going to do what we know that we should do. We don't need to wait to be reminded. As far as the shortage of staff is concerned, the governor authorized that we replace all the positions where we have had attrition, either by people going outside the country or by resignation, retirement, or death. And we have already had a list of the positions that need to be filled in the health sector, 256 positions to the Public Service Board. And out of those, 146 are nurses. There are some casuals who are nurses. Let all those who have been working with us, if they qualify, let them be absorbed first, and then if we will not have the numbers, then we can advertise outside. Concerning the UHC staff, we are aware that the UHC national and the UHC county, we are aware how they came in. As a county government of Kiambu, we would like to enumerate our UHC staff like any other staff in our hospitals. But now they are tied. Our UHC staff are tied together with the UHC national. So what happens in the national is what happens to the county. We have got no control over that. We will wait until the time that the national government now will tell us, now absorb all the UHC staff, national and county, absorb them, and then we are able to now enumerate them like any other person who is equally qualified. We are going to continue improving on our service delivery, on how we deliver drugs, supplies to hospitals, such that our hospitals are up and running 24/7 with no hindrance, with no hiccups. Drugs and supplies worth 45 million. is now being supplied. In 2 weeks, is now being supplied to our level 2 and level 3 hospitals. And once we are through with that, we are going to go another route, supplying non-farms to the same hospitals, to the same facilities worth 10 million. And once we are done that, as we are doing that, we are also going through our level 4s and level 5s, also making sure that they have enough stocks of medicine and non-farms. So we are doing our best to make sure that we create the right environment for all our hospitals or our staff to work in. That is why we have made that effort to make sure that drugs, supplies, and everything is in order. That's why we issue those promotion letters. And my ask is, please, even as we do that, let us also be take this work, our work responsibly. Let us use what is provided to us responsibly. Let us avoid any form of misuse, loss, and make sure that all those supplies benefit the intended beneficiaries.
We have noted that there is shortage of nurses in our hospitals and other staff. This is not unique to only the county of Kiambu. This is an international problem. But as a county of Kiambu, we have decided that in the short term, we are going to replace the nurses that we have lost, either through migration or through attrition or through resignation, retirement, or even some have died naturally. We have decided as a short term, we are going to replace all of them. And very soon, there will be an advertisement to that effect, even as we look at the long-term solution to this problem. 3 weeks ago, His Excellency issued promotion letters to our healthcare workers, just to make sure that they are well enumerated, so that they are happy themselves, and when they are happy, they will be able to take care of our patients properly and the right way. So we are taking care of our healthcare workers, even as we also make sure that our health facilities, all of them, level 2, level 3, level 4, level 5s, that all of them have got sufficient drugs, sufficient supplies, everything that is required is available.
My name is Dr. Waturi Kibuti. I'm the medical superintendent, Thika Level 5. I've been here for a month, and I can tell you for sure, I've seen a lot of changes, even in terms of supplies. I was still working within Kiambu County, so I know the supplies status from the January. And we're seeing now change, even the things that we were not able to get previously there before, because now we've been able to streamline the procurement process. We are able to get the drugs in the hospital, we are able to get the non-pharmaceuticals in the hospital, and also in the hospital, the Thika Level 5 being the biggest in the county, we are also planning to do a lot of renovations through the county and also through some of the donations that we are getting. Thika Level 5 is basically the trauma center for Kiambu County, and we are in the process of improving emergency care by coming up with a trauma center. You realize where Kiambu Thika Level 5 is on the highway. Is on the highway, both the Nairobi Thika Highway and also the Garissa Highway. So we are situated in a place that we should always be ready for trauma, and that we are working towards that.
Naitwa Naomi, mimi ni mkunga kwa kimombo ni midwife, na mimi nafanya kazi katika hospitali ya Thika Level 5 ambayo iko Kiambu County. Kumekuwa na upungufu sana wa wakunga pamoja na wauguzi katika mahospitali zote. Najua sio Kiambu peke yake, hata katika Kenya yetu, lakini His Excellency the Governor anataka kulead vizuri by example na kuleta wakunga pamoja na kuleta wauguzi katika hospitali zote za Kiambu County, na tunashukuru sana kwa sababu matibabu itaweza kupeanwa vizuri kwa wagonjwa pamoja na wamama ambao wanakuja kupata watoto katika mahospitali zetu. Tunashukuru wakati kuna upungufu wa wakunga pamoja na wauguzi, unapata ya kwamba wagonjwa watakaa sana kabla wahudumiwe, na wakihudumiwa wanahudumiwa mgonjwa mmoja anahudumiwa, wagonjwa wengi wanahudumiwa na muuguzi mmoja ama mkunga mmoja, hawezi kupeana services ambazo ni za kutosha ama ambazo ni za kufaa. Kwa hivyo tunashukuru sana kama tutaletewa wakunga pamoja na wauguzi wengi ndio tuweze kufanya kazi, and we want to promise ama tunataka kuhakikishia Excellency the Governor kwamba sisi tuko tayari kumsupport katika kuhakikisha ya kwamba the maternal and newborn health imewekwa iko katika hali ya juu, na hakutakuwa, tukikuwa wengi hakutakuwa na shida yoyote kama kupoteza lives katika kaunti yetu ya Kiambu.